and we were talking about the various aspects of the faith community and what they could be doing with respect to making things somewhat better in terms of developing a better relationship. Let me say that from the standpoint of the Rochester community itself, the relationship still is not workable in a sense of a total dismissal of the mistrust. That factor is still there, but it is better simply because the community is making steps to create a better relationship as well as the medical community. Most importantly is the work from the University of Rochester Medical Center, which both the psychology department and the psychiatric department are really courting the community in terms of service. So we want to keep certainly a watch on that and see how it can be improved even from our perspective. So we'll get started today on this point, and hopefully we'll be able to begin our work on the prisons on Wednesday. But I think, though, that at some point the church is going to have to provide simply the leadership, because when we say the church, we're talking a multifarious. No matter what community you're into, if it's an urban community, we're talking a lot of different faith communities simply because of denominational perspectives, because of individual perspectives, because of a lack of or pronounced leadership in these areas. We're talking about various forms of control, whether it's congregational or whether it comes from the leadership aspect of these churches or these religious institutions, seeing that now the trend tends to be not to refer to one's religious assembly as a church any longer, but just to refer to it as a faith center, as this or as that. So it's very, very, very confusing. And there is no single aspect of collaboration that would call for a singular approach to this major issue. And here we're talking mostly poor people. We're talking people that are trying to get off of the canvas as best they can and look to their faith community and its leadership for that. And then it's a question of the leadership, simply because mental illness is not really, has yet to be equated as a priority, unfortunately, for most faith communities. And as a result of that, the tendency is believed to be that one can have one's mental stress dealt with at the level of either the church or whatever faith assembly we are talking about. And it's dealt with by not ever mentioning it. And I think that is one of the issues that needs to be faced. We also have the possibility of it being taken out of the pulpit per se and given as a part of some would call it Christian education, but at least some teaching function that exists within all of these. That's a possibility too, if the leadership lacks the determination to deal with this straight from the pulpit. But again, one of the features historically of black churches, whether they're large churches or whether they're the very smallest ones, is that we have not had really a pronounced agitative movement of teaching. And if you lack that, that makes it even just a wee bit more difficult to do what we're talking about. But that is what is needed, and that is what we are attempting to bridge through this course, how that can take place. I say again that at some point, the church or the faith community in these urban areas must themselves provide the leadership to create an understanding, a constant willingness to develop collaborations with the health community. Now, churches, mosques, and other religious entities, some of them, and let us not forget this, some of them are bravely struggling with saving its people, families, young people, trying to keep them from decimation and from violence. It's a very heroic venture that many of them are into. On surface, we would say unsuccessful at this point, but it's there. There's virtually no other organization anywhere that's burdened with this enormous responsibility of providing both spiritual and social recovery more than these black churches. No matter whether they're large or small, house churches or storefronts, they continue to serve the most rejected and neglected people that there are. We talked about that a little bit on last week. But let's understand this, and please understand what I'm saying. This is not a rejection or a put down of any form, but this is my opinion. And my opinion is that much of what we call recovery within the community, much of calling the community back to some level of correctness, this lies with the poor themselves. It lies with the poor themselves. Now, the poor may be powerless, which they are, but they are not helpless. Two different things: powerlessness, helplessness. You can be powerlessness, you need not be helpless. Both the faith and the medical communities must together develop a healing strategy which can empower the poor to become self-determinate in defining their own destinies. So we're talking about ministering to mind, body, and soul. And what this does, it objectifies the whole person. We talk about holistic. Every course of study you take, people are talking about holistic. But what we want to do is to develop the whole person. Now, wholeness equates to what? A term that we use in another form in sociology is self-actualization. Self-actualization. That itself equates to human freedom. Self-actualization and human freedom. And if we want to define that, empowered to define who a person is, who they wish to become within the essence of freedom. Who a person is, how are they defining who they want to become within the context of freedom? The prime concept behind any struggle is freedom. If we look at the struggles, the conflicts worldwide right now, underlining theme on all of them is some form of freedom. Freedom, whether it be violent or nonviolent. In this country, the feminization movements, they're movements for freedom. Freedom of women to choose, freedom of women to define who they are, freedom of any group of people, any race of people to define who they are. Freedom. I have the right to assert myself if I need to. Freedom. But the poor, the really abject poor, never, simply because their destiny is always in another person's hands. So what we're talking about here is actualizing some degree of empowerment, of freedom. Now, whether we're poor in spirit, whether we are mentally distressed, no matter what the affliction of the human being, there must be some support in their own struggle for institutional accessibility. If what I need to become whole rests upon this mountain called the University of Rochester Medical Center, the University of Rochester Medical Department, and that's where I need to be. That's where I need to be seen. But that institutional accessibility must be understood to be there for me. And you know, as we get along here, I know you're either Democrats or Republicans. Well, that's fine. But what we're talking here conceptually really is, in some instances, socialism. Institutional access, without question. Socialized medicine, that's something we used to look at 40, 50 years ago, simply because it seemed to be working in Canada, which is just a short drive from here. Or the socialized economy, they were looking at that very strongly in the late 1970s and 1980s. They looked at it so strongly that the boom, 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 in the Roman Catholic Church, they had this big meeting, lasts about a week, once a year, of all the bishops. I forgot what they called it. Bishops Conference, maybe all the major bishops from across the United States. They select one issue and they deal with it, and whether it could be race, but I remember the one on economics simply because they strongly looked at what Canada was doing and what has happened in the Scandinavian countries and in England with respect to less of an emphasis on capitalism and more of an emphasis on the equal distribution of wealth. Of course, it did not fly beyond Congress, no matter what the bishops might indicate. But nonetheless, it was looked at. So, but all of this, when we talk about the person, though, when we talk about poor people, when we talk about institutional access, that not only means to medical care, it means to education, it means to everything. And fortunately, in this country, the university systems across the land have, most of them, if not all of them, have deferred to poor students who are academically sound, at least, to attempt to come and deal with the whole question of academic development based upon their ability to do so. But total institutional accessibility for poor people with respect to medical care, mental health care, is something that's somewhat in the distance. Now, we can state this, though. We can state this, that beginning with the dynamic of faith, we also have the dynamic of medical collaboration. The two can meet. Spiritual leaders, medical and mental health practitioners, coalescing, coming together for total good. And for the moment, let's assume equality, because you can't do this unless you're partners. You can't be a partner with anyone that's not your equal. That doesn't work. Now, can I wax something personal here? This is not, y'all don't have tape recorders, so you don't have to turn them off. But this whole thing of equality is just now making its way into marriages. There's no such thing as marriage is number one is love. You're falling in love. You fall in love, head over heels. You want to get married. Fine, that's perfect. Get married, have some super children. But next to love is partnership. Partnership is equality. You have to have equality, or it's not a partnership. One can't be up here and the other down below. That doesn't work. That doesn't work. So when we talk about medical and mental health practitioners coalescing with spiritual leaders for the common good, then it means equality between the faith community, the medical communities. The church is believed by many to be a divine institution, isn't it? Yes, the church is considered If any of you who are Christian, you might be something else, but the church is considered to be a divine institution because God, it represents God on earth. Now, I'm going to tell you something that you might not have heard before. This clarifies the responsibility of religious communities to humankind. All right. But so too is the medical, mental health community a divine institution. Y'all know that? It is. This place is a divine institution. Whether one will want to admit it or not, it is. Because of the universal belief that all healing of the body, of the mind, of the soul is divine, as emanating from the power and mercy of God. That's neither Christian, that's neither Judaistic, that's neither Muslim by itself statement. It is a common statement that all healing is divine. So if all healing is divine, what about the faith community has the responsibility of the soul? Who has the responsibility of the body and of the mind? So all medical and scientific knowledge given to the world originated with the first cause of everything. All medical and scientific knowledge given to the world originated with the power that has been given to human beings. As the church has the spiritual authority to condemn evil, that's what the church does and other religious institutions. They condemn evil. They condemn immorality. They're supposed to. So too the medical community has the moral authority. Note what I said, has the moral authority to condemn squalor and pestilence and disease. Because the mental health agencies have the understanding and the knowledge to equip them to attack those things. Squalor, pestilence, disease. I've talked about Viktor Frankl a lot in this class because he was such an inspiration to me. But as we know, we talked about it, he's the major architect of what we call logotherapy. Again, I'm going to say that he was a Jewish psychiatrist who was a death camp survivor at Auschwitz. And in his work, Man's Search for Meaning, in reviewing what his concept of neurogenic neurosis is, he writes this, and I'm taking this from the book. The neuroses, neurogenic neuroses. It does not emerge from conflicts between drives and instincts, but from conflicts between various values, from moral conflicts or from spiritual problems. And he goes on to state this. Spiritual issues, such as a person's aspirations for a meaningful existence, as well as the frustration of the same aspiration, are dealt with by logotherapy in spiritual terms. Now, and that's what I use when I counsel folks. That's why it means a lot to me. I like it. Now, I'm closing out. Now, what was once possible in terms of what the church would call or could facilitate in spiritual terms is no longer sufficient. It's no longer sufficient. Faith communities are now faced with the compelling need to referentially treat I can take you but so long, so far. After that, I had to refer your situation to someone else if it's okay with you. I can't do it unless you say so. But faith communities are now faced with this whole thing. And it's not competition, it's healing. Faith institutions must treat, counsel, and offer holistic ministries through referrals in conjunction with medical and mental health institutions. It's such a simple formula. So that ministers are no longer able to resolve all of the issues of the poor. Nor are they, in most instances, any longer expected to. But we do have realizations. Realizations are born of the faith and scientific community to engage in a collaborative spirit where mutual trust is established. And this presents a stirring picture of positivity and possibility. Whenever we engage in anything, whether it's been resolved or not, as long as there's a possibility, we get into it. Remember that, young people, in your lives and start your career. If there's a possibility of it working, deal with it, if it's positive. Now, as my last word, the rest of it's going to be up to you. But let's say that we're able to broach a collaboration like this in most of our urban centers. We're going to have to understand, again, I'm going back to a few minutes ago, it has to be a partnership, and it has to be shorn of all white institutional paternalism. With both communities striving as equals, doing what each does best. I'm not a doctor. I'm not a psychiatrist, a psychologist. I'm a minister. Okay, then do what you do best there, and let the medical people, the scientific people, do what they do best here, and then just collaborate with what you know and what you do for the sake of the people. Both communities striving as equals, again, doing what each does best, will provide liberation for the poor. And I also always like to remind doctors that there's a Hippocratic oath that they're supposed to take. Liberation for the poor and Hippocratic glorification to an unselfish group of professional people. Whoa. Now, questions, come on now. Y'all talk about this. Talk about something related to it. About the lack of, or what you see as developing as collaborations. And work on these instincts to make things better for our total community. Let's say worldwide. You know, we talk about Doctors Without Borders, and so many positive things are being taken out of the country as if to labor for these things within the context of this country, not quite what we expect. That's because of the money level. There's so much money that's required to do this and to do that. Not much money is required to do that, where people are so abject that they're dying every day. You just go in, you to do something, but you do it selflessly. But that's that. I saw a hand in the back.
Yeah, I just wanted to say, like, I think there's a problem on both ends. Like, I know a lot of people in the church don't really believe in medical, like, advancements.
Yes.
They're very, like, opposed to it. Like, well, and then, like, the people in the medical community are like, they don't really, a large proportion of them don't believe in the spiritual community. So because they don't, like, believe in each other's power to heal, it's, like, really hard for them to work together.
You know, much of that has been resolved in the past through the courts. For example, and I'm sure you're aware of the fact that we have a few faiths that do not believe in blood transfusion and will risk someone in their family dying, a child. We will risk that and not have a transfusion. When it was found out several years ago that bad blood can be transfused from one person to another to cause HIV and AIDS, that threw a major scare into a lot of people because HIV and AIDS was considered by many people as being a sin, that it was a punishment that came directly from God on people who just sexually misbehaved. We have a lot of situations in this country that has stymied the medical profession simply because, it's just, Weaver said this, oh, I'm sorry, I didn't mean to call you sister, I'm so used to being in my church, everybody's a sister so-and-so, or brother so-and-so, so if I slip and say sister, y'all know what I mean. But we have that a lot now, still. We have congregations, as you said, that have taken a stand, no matter what the leadership says, that they are not going to involve themselves in any kind of medical situation because, in their view, biblically, that's against God. You know, one would say, trying to be rational, how can it be? Why do you feel this way? When I came to New York to go to graduate school many years ago, in order to get married, you had both parties, the man and woman, had to have what they call blood tests. This was long before HIV and AIDS. The blood test was to make certain there was no sexually transmitted diseases afoot, syphilis, gonorrhea, any of those things, or that there was nothing in the blood that could determine, even minutely, the possibility of a child, in case of a child being born, that there would not be some kind of mental situation like children, they call, what's that term they use for children? People that are born with malfunction. Down syndrome children. That's why the blood test. Now, in the 1980s, they discontinued blood testing altogether for people wishing to get married. Well, you don't have to require it. All you need is counseling and, $5 for the marriage license and a wedding, and off you go into the wild blue yonder, flying high into the sun. That's a World War II song about the Air Force, y'all would know. But that does exist. It has to be determined, in my opinion. This is what needs to be done. You take if you take a congregation or congregations who believe in this kind of thing, what is needed is people within that those congregations, those denominations, who are part of what is termed leadership, to have a teaching conference on the need for people within those institutions to understand the viable need for medical treatment. I don't know of anything that I would not go to a doctor about, although, you have faith on one side to believe that the Lord's going to take care of you, but at the same time, you need to understand that who gives all this revelation about prescriptions, about anything else. So I can't answer that question other than the fact that that's one of the tough issues. People, the doctors themselves have taken parents to court because they would not permit them to give medication to their children that they know would save the lives of their children. And the court always sides with the medical profession. It never sides with the other side. And it should. We're talking saving lives. A child cannot determine himself. Parents have to determine that. Even a teenager. The law says until they're 18, they're under the total supervision of parents. So if my child is 17 and there's a need for an operation to save her or his life, I'm not going to say no to that. I'm going to say yes, by all means. And if I say no, I'm saying it to the detriment possibly of my child. But that's what we're up against. And it's a strong, strong opposition too. It's less now, but it's still out there. It's out there, and I hope none of you belong to the Jehovah's Witnesses, but it's still a very strong piece of Jehovah's Witness teaching. It's a strong piece of several other ultra biblical forms of religious groups. Not necessarily a church, but an association, an assembly that says that medical practicing is incorrect. It shouldn't be. That you don't need to worry about anything. If you have faith, you'll make it. What's the most pronounced thing you think is going on? Let's say in Kentucky, West Virginia, Tennessee. Those three Bible Belt states. What's going on there that really continues to dazzle the mind with respect to this whole question? You ever heard of rattlesnake cults? Churches in Kentucky, in West Virginia, and Tennessee that believe that they come into church with one of these big burlap bags full of rattlesnakes that have been caught, and they dump all of them on the floor, and you have the people sitting there. And the thing is that if the rattlesnake bites you and you die, it's only because you have a lack of faith. And it goes back to scripture where it said that they'll pick up vipers and they will have no power over you. I said, yeah, but that was 2,000 years ago. This is 20-something else. I'm gone. You jump some rattlesnakes in my church, I'm gone. Everybody else, I'm gone out the window, out the back door, someplace. No, but I mean that's the thing that's going on now, and the law cannot do anything because of the fact that we have separation of church and state that they hang on with respect to rattlesnake cults. Now these are poor mountain people who live in regions of West Virginia, Kentucky, and Tennessee. And it's real to them. People have been bitten and they have died, and it's because it's defined that they have lack of faith. But they will not ever, for one instant, go to a medical practitioner with respect to that. That's all hand. Yes?
Is it the person who gets bit's choice to not go, or like, is it like the church telling them like, oh, like you can't go?
Well, you know, it's like any other church. You have to be converted to be a member, and but a lot of people don't go simply because of that. No, it's nothing that's arbitrary. People just go, and they're rattlesnake cult churches. This is built into their theology, that a proof of your faith is the fact that you can pick up, you can handle. These snakes are all over you, and they bite you, and you die. Then you have a faith problem.
A reporter did a series on these rattlesnake churches. It was on PBS, and he eventually became, I guess I would say, enmeshed and enamored of what they were doing in terms of having this kind of faith to believe. And he did. He picked up the snake bit him. He didn't die. He had faith. But it was amazing. Like when they dumped the snakes out, I'm like, yeah, I would have been like making for the door. But they and I think it's a combination. When he was interviewing people, why they did it, it was they wanted to know that they had faith in God. But then, you know, like in the moment, it's also the church. They're looking at you, the people that you're fellowshipping with from Sunday to Sunday, the pressure to pick up the snake and see what happens. But I just think, wow, it's another
I've been
dimension
going
of faith.
And as I would leave, I'll be quoting scripture to them that says, faith is the evidence of things not seen, and or faith is the evidence of things not what?
Faith is a substance of things
And,
not
but,
seen.
and, but the evidence of things not seen.
Yeah.
As I jump through the window, I would tell them this thing. Go ahead.
I think there's also a disconnect in the poor community with the medical, because like you said before, is that they're powerless, so therefore they feel less respected in the medical community and more like they'll be experimented on, especially after like some of the things that we see in history, like what the medical profession did with syphilis with the powerless people.
Yes.
So there's like always that overarching fear, because they know that if something were to go wrong, that they would be powerless in fighting against the medical community. And so that also hinders them from collaborating with the medical community and really just relying on what's worked for them in the past, which is the spiritual community.
As long as there's history, there's memory. And one of the things we have talked about with respect to poor people is that they do remember the Tuskegee experiments. They do remember the syphilis epidemics. They do remember some of them who were really down in history. Remember when the University of Rochester experimented with poor people with this agent called plutonium. Woo, there's a lot of stuff out there. A lot of history that has happened, but it's no longer happening, but because of the fact that it happened, has made the decision for people not to involve themselves in it.
Well, that, and there was no reparations. Like when the universities were found at fault, it was more like, oh, sorry, we won't do that again.
Yeah.
It was really no like reparation within the community to fix that emotional trauma that they had induced.
Yes, indeed. That emotional trauma, and that's a good term, emotional, because it will end up affecting mental sensibilities. And as a result of that, with respect also to what has actually happened, raises some key points. Now, when we talk about the prisons, we'll find out some things are still going on. Lobotomies, everybody knows what a lobotomy is. That is still being practiced on some men in terms of involuntary medical intrusions in their lives. There's also sterilization. With women prisoners, there are forced hysterectomies. And all of that collaborates itself into a very forceful kind of historic memory. But some of those things are still going on because prisons operate basically as institutional entities to themselves. We'll talk about this a lot, especially when we have our guest, Mr. Remy, to come in, because of the fact that he's been dealing with this for years and years and years. But we know other comments, please. Yes.
Just a general comment about this. So last semester for an internship, I did like one of the literature reviews that I had to do was kind of specifically about this, and about specifically within the area of different collaborations within Black churches with medical and academic communities. So really kind of touching on this, and it was really interesting to see the kind of more recent uptick in research and related papers on this within the past 10 years or so. Because before there, it was here or there, but kind of more recently what the kind of interventions that they've been trying, have been putting a lot more emphasis on kind of empowering the church to make these decisions, kind of like what you were saying, that we need to, the people they're powerless but not hopeless, and kind of putting the emphasis more on the pastors to say, like, this is something that we're going to be involved in and we're passionate about. So like showing people that there can be a good collaboration between it.
And important, relative to what you say, is imposing on people the necessity to seriously come to their own understanding about what is relative and what is not with respect to health and mental health. And what really bothers me and what bothers a lot of people with respect to this is that even though the facts are there, I mean, there's no question about it, still they will reject it. You know, and that's, to me, it's incorrect, and it, pardon me, shows a lack of self-determination. That's one of the major aspects of human freedom, is self-determination. Determine ourselves. Let's determine this thing, and for the good of everyone. You know, when I was in the Army, at one point, I was in a group that had some guys from Oklahoma, and they used to tell us that they would go out on rattlesnake hunts, and they'd get it, you know, it was for money, and whoever would catch the most, I think the most or the largest, because they had measured them, would end up getting some money. And said, "You guys ever get?" Oh yeah, we get. And they look, show you the teeth marks. But some people have a fear of snakes, and some people do not. If I see an earthworm that looks too large for me, I'm letting it go by. I'm not gonna mess with it. But at any rate, that's one of the things that is really defined to the rational imagination, that there should be such a tremendous amount of resolve not to collaborate. And I don't think this is what is hindering most of the urban religious institutions, though. I think it's just a question of not knowing, a lack of understanding, a lack of really attempting to do what is best for the community. And in the sense, or in the case of many spiritual leaders, it's the fear that that their power, their authority will become compromised. If I had to go to a doctor to tell any person that they need to go for what is wrong with them, then that means that I am not quite suited for what I do. And that's something that's not true. It's not going to happen, but that's what a lot of leadership feels anyway. That's what needs to be avoided. One of the things that has caused a great deal of problems, we thought was what once quit, but it has resurfaced and has resurfaced in the past 7 or 8 years with abandon. That's lead paint poisoning. That was at one time found in the majority of the homes owned by slumlords, not landlords, who refused to eradicate the lead paint, the lead-based paint it's called, and you can do that by simply painting over it, but who refused to do that. Now, a lot of public health workers became traumatized themselves because they found out that little children living in these dwellings oftentimes eat the lead paint, and lead paint is like sugar cane. The more you chew it, the sweeter it gets, and this was affecting a lot of children. And it caused the disease called pica, P-I-C-A, which immediately attacked the brain, and psychologists found that children who were exposed to lead paint had the highest ratio of mental incompetence. That they were, once they started to school, they were 2-3 years behind, and it was just something that would affect them all the way through. Now, Tom Horton, you may not remember, he was a Republican congressman. His name was Tom Horton. And the poor community here in Rochester, through a program that the Urban League had, attempted to deal with lead paint by having it removed, trying to have legal statements, enactments, but it didn't work. But Tom Horton was a very responsible congressman. He spent a lot of time with the poor, trying to deal with those problems. So he was invited to tour much of the poor community on the seventh ward, and he did. And he saw things that he had never even imagined he would see. And when he learned about lead paint and its culpabilities, he went right back to Congress, enacted a bill called the Anti-Lead Paint Bill. It has a number to it, that Congress passed, which required all slumlords throughout the United States to eradicate lead paint from their dwellings and to paint and to issue non-lead based paint. As a matter of fact, they passed a law that you no longer could make lead paint with lead in it, lead based paint. It all had to be the other way around. Then, lo and behold, in the late 1990s, I don't know what happened, lead paint started appearing again. And now slumlords are utilizing lead paint, and lead paint poisoning is again near the top of the list of the afflictions that children are very vulnerable to. Poor children are very vulnerable to. Now we have individual groups in communities organizing to confront this issue rather than it being thrown right back into the lap of Congress so they can make it reaffirm the fact that it's against the law, it's illegal to paint a dwelling with lead-based paint. But that is what has happened. That is one of the major issues, as I said, affecting children today. But it goes on simply because there's just not this issue. You know, if you look very carefully, if you listen very, very carefully to any of the presidential debates going back 18 months, you find children, their names, never mentioned. Who cares about a kid? Nobody. Why do we have such a high level of child sexual abuse and child physical abuse? Because children in this country have no human rights. They're the most vulnerable people in this country. So that's why the evils of abusing children, whether it's physical abuse or whether it's sexual abuse, is so high, and the perpetrators still get off very, very softly. Only because reporting now is becoming so pronounced in this area are we really seeing it. But it's out there. It's everywhere. How do we deal with it? How do we deal with children who are being abused? Because that abuse never leaves the mind of a child, and it affects them as they become older. If it's a girl that's been sexually abused, it affects her ability to have a good, normal relationship with a young man at some point in her life. The children who are abused will turn out to be, in some instances, abusers themselves. I'm sure you'll hear Mr. Rennick talk about this. Talk about over 60% of men in prison were abused as children. Lord have mercy, what's going on? I have a friend, he died, he's gone now. His name was James Schmidt. He was a good guy. He was smart. And about 30 years ago, he won one of these scholarships where he could go to the Soviet Union to study for 6 months and come back. And all the time that he was there, he not at the same home, but at different homes, he was the guest. And he stayed with Soviet families during that time. And he said that was right after Ronald Reagan depicted the Soviet Union as the evil empire. That was before you were born. There was an incident that President Reagan came on and said that the Soviet Union was an evil empire. But at any rate, he said that when he would go to these homes, there would be young people his age. He was expecting some tough political talk about the Cold War, about this and that. Yeah. He said almost everywhere he went. He said people always ask him, is it true that Americans abuse their children? And they took him to Petrograd, which used to be called St. Peter's, where they have a huge shrine. It's on the inside. They have lighted candles all around because that would indicate the 20 close to. I'm trying to get the. I'm going to miss it because it's been a long time since I've talked about this. But the Russian people between 1941 and 1944, particularly in the city of Stalingrad, the largest of the Russian cities, lost close to 10 million children. And so every lighted candle is in memory of those children. They lost 20 million people total, and a large number of those children, those statistics were children. So it means that we have a lot of work to do. You all have a lot of work to do. I mean, y'all are going to change things. I don't have anything to do. I'm sit back and read the papers. Oh, I don't remember Miss Weaver. She was in my class. Yeah. I remember Dr. Taylor or Dr. Thornton. I remember her. She was in my class. Now she done discovered how to get rid of something. All y'all do. Deal with lead paint, you're going to deal with all of these things. You need to know that whatever you choose to be, you're going to be uncomfortable with it. Simply because that's the way this horrible, wicked world is conceived and how it's operated. That there are numbers of people who just don't count. Children are one of them. I don't care if it's a rich child, a middle-income child, or a child that's struggling in an impoverished area, but especially an impoverished child, they don't mean too much. They don't mean too much. So remember that. We got to really deal with that. Come on, talk to me. Talk to me. How many seniors? 1, 2. Oh, y'all going on. Oh, Miss Harper, you going on out there now?
Yeah.
All right. Yeah, but unless you go to graduate. Now, see, you can go from being an undergraduate to a graduate student, and then you can be a professional graduate student, so all you got to do is sit back and write about things. If you're going to go out there, now you're going to be a participant. You got to kind of get your hands dirty, but that's good. That's good. Don't be afraid. Well, fear is normal. You can be afraid as long as you have a moral commitment. Talk to me now. How are we going to bridge this gap between the community and medical institutions?
2 things. One is going back to what we were talking about earlier with the faith community, or people having faith not to go or not to avail themselves of medical services. I was in a situation myself personally, and being raised in a church that was faith believing, that God is able to do all things but fail. I had a daughter that was born prematurely at home. She was 3 months early, and so she was taken to Rochester General first, prepped, and then brought to the neonatal center here. My other births were natural, so when I walked in and she had needles in her head, I was like, what is going on? And they were saying, well, with the preemie, the brain, the vessels in the brain are the strongest for baby, because the other ones collapse after a couple of hours. I had to get used to that. And then she'd been there maybe 2 or 3 weeks, and they told me that she didn't have a bowel movement, wasn't having a bowel movement every day. So they were going to do surgery. And being a person of faith and being a person that prays, I knew that this was just normal. I said to the doctor, well, the only thing that you're giving her are liquids. So is she urinating? Is she not urinating? Yeah, she's urinating, but she hasn't had a bowel movement. She should have a bowel movement every day. And I said, well, I'm not sure what your research says, but you're not going to operate on it. So the doctor then said to me, well, you signed a form. And I said, yeah, I did sign the form. I wanted treatment, but I think I know that the surgery is not necessary. I know that she will have a bowel movement, but you're not putting anything in her to get a bowel movement. So the doctor and I had words. It was the chief resident. Then she brought in the supervisor there at this hospital, and he said, well, you don't give us any choice, but we're gonna have to take you to court. Well, you have to take me to court, and by the time you get the paperwork done and everything done, she'll have a bowel movement, but you're not going to do surgery on her now. And I can remember the hostility from the medical staff, and my husband said to them, we believe that you have the gifting. I mean, God has given you this ability because you have kids that are doing, but we also know what God is telling us. And so we're taking you to court. And it was the nursing staff that said, that talked to us in more humanistic terms, like, are you sure? I mean, I understand, and, whatever. And I said, well, no, I know that she's going to be okay. And the day that they went to file the paperwork, because I think it took them maybe 3 days to do it, she had a bowel movement, and so I said, so I think that there are some children sometimes that don't fit the norm or the pattern that, you're used to, and you have to give it time, but I have the highest regard for the neonatal unit here and the work that they do, the social workers, the nurses, the doctors, the residents. It's phenomenal, but there comes a point sometimes where your faith is really tested, and I think that was one of those times. I know I did the right thing, but if it had been anything else, I probably would have said, okay, have at it, because that's why she's here. I mean, it is out of the scope of my ability to help or to heal her, and nobody else that I know can do it except the medical profession. And so it's in those instances sometimes where I think some parents, given the intensity and just the and I believe that the doctors are passionate about helping and assisting, but it was in that moment that I'm thinking, wow, they're being really vile to me. I mean, I understand what they're doing, but there wasn't an opportunity to really dialogue with the doctor. It was like, it was this way, this is the way it was going to be, and since I wasn't being compliant and I was being a bad parent, they were going to take me to court. And I don't know if it was the idea of saying, I'm going to take you to court, that was supposed to make me capitulate. I'm just not sure. But I know that in that moment, I think that if I had been a younger parent, or maybe a single parent, or somebody without support or networks and all, it would have been difficult not to succumb. And who knows what the consequences would have been. But fast forwarding to community partnerships, I think they're doable, they're viable. I think about the vice chair of the Department of Psychiatry. They partnered with, I don't remember the name of the group, but he was saying how in the partnership they thought they were being equal, and he said, I'm being mindful of all the missteps that have been made. He said, and then I realized that we still had a paternalistic approach to the agency.
Yeah.
And he said, and I think the agency gently but firmly took me to task as being the PI on this project and saying, no, you're overstepping your bounds. You have this area of expertise, this is what we're deferring to, but you're stepping over here to what we need to have. And so I think it's a very delicate dance, and I think the first go round, there are always going to be some hiccups. There's always going to be some slapping of the wrist, and I think, but like you were saying, I think each partner has to understand their role, stay firmly entrenched in their role and what they're gifting and what they're supposed to do, keep the other one in check, and vice versa, and it'll eventually, I hope eventually work out. It'll eventually work out.
I'm gonna ask what everybody around the table wants to ask you. How's your daughter?
Oh, she's fine. You know, they were saying, you know, the surgery, she's went on to be valedictorian of her class. She always wanted to be a chemical engineer. Graduated from Clarkson College, got that chemical engineering degree. Worked for General Mills, Mills Company, so she's fine. She's absolutely fine. I mean, it's amazing to see. It is. It's amazing to see when we were there, the kids that have problems. You just are exposed to some things that I was just like, oh my God, this is just amazing. One little baby was born but had no membrane on his chest. The father just kind of lost it, walked out. The mother was not doing well emotionally and physically, and here are these aged grandparents that might have to take the responsibility for this baby because the parents were unable to do that. Some baby with webbed feet, babies born with water on the brain, heart murmurs. You know, you just are like, wow, my kid is, she's got these problems, but she's really going to be good compared to all of that. But and it's just amazing what medical science is able to do.
I mentioned to the class, I think it was last week, that 2 weekends ago, or last weekend, I went to see a patient in the pediatric ward, and I had to walk down a long corridor. The doors were open. I saw a lot of babies, children, big, very young children, toddlers, with all kind of tubes, and just really tough. It's a tough walk. But you're right. Medical science is a blessing, but there has to be a way in which this collaboration is going to work so that the risky physical situations and the mental situations a lot of people can at least be addressed. That's going to be absolutely important. Well, is that why everybody's looking that way? We got about 5 minutes. Any final anything you want to say? Yes.
I think that there's a lot to be learned by medical professionals when it comes to if they really want this holistic approach to medicine, then they really have to look at the background of the person that's coming in, because if they're trying to explain something in medical terms, then
understand.
right, so if they can explain it in like, oh well, I know that you follow like this religion, and like I know that this is how it has been explained to you in the past, but as a medical community, this is how we see it. Like if they can relate it to something that like they've known before, it makes more sense. And like you said, the nurses came to you with like a more humanistic approach, and I think doctors, like, you can't force compliance from patients. Like there's no way to force someone to be compliant with you, but if you work with them, they're going to be a lot more willing to work with you. And I just think that has a lot to do with the mental health outcomes of clinical patients and stuff.
You're right.
I just want to add a humorous story to what you're saying. My mom just celebrated her 89th birthday. Has never taken any kind of medication, and she got older. There were certain things that she needed to take. And so she was taken to the hospital, and the emergency room physician, I had to high-five him because my mom was like, no, I'm not taking this, I'm fine, and whatever. And so he said, you know, it's been a long time since I read the Bible, but I think one of Jesus' disciples was a physician. His name, my mother's like Luke. And so he said, so if Jesus had a physician with him, you think I got a shot with you, you know? And so my mom was like, that's really good, but no. But eventually, I mean, he talked to her in a way that she's like, okay, well, for you, I'm going to take the medication. You know, we're like, oh my God, you know, mark this date on the calendar, we can start here. But it's true. I mean, he just was able to touch that piece with her and challenge her in a way.
Bedside manner.
Yeah, it was. It was just absolutely amazing. It was like, okay, wish I could clone you and put you in emergency rooms all over the city.
Now, I told you that I have 5 biological children, and my wife and I adopted 2. Now, the last child that we adopted, they had already given him up. When he was born, he weighed barely 2 pounds, and they told us that he was going to be blind. This was going to be wrong with him. That was going to be wrong. He had to have 2 hernia-related surgeries in his first 9 months, plus hospitalized for other evaluations. And we didn't know, but you know, we said, we're going to take him anyway. You know, that dude, he's all over the place. He's in regular school. He's doing top flight academic work. Yesterday, we also adopted a daughter. She's 10. He's just turned 9. And my daughter came downstairs, ran over. She looked so nice. She had her hair done. She's 10. I said, honey, you sure look nice. And he said, he stopped eating. He said, how come you didn't say anything complimentary to me? So, you know, you're like, the medication, we didn't hardly do it. When he was about a year and a half, he started eating black-eyed peas and collard greens and chicken, and that's what he wanted to eat. That's what we gave him, and that's how he got over. So, yeah, medicine is good, but still you have to bear in mind what your grandmother says about things, about how they used to do things when there weren't any clinics or any of that, one or the other. But all that's fine. That's why when you have your first baby, you're going to call for your mother going to spend a whole month there. And that's good that's the one time that's good for the son-in-law, because he's going to get some good cooking. But that's part of it. That's part of it.